conjunctivitis. Now, this could be caused by just a simple mechanical irritation. Maybe you just scratch your eye a little too much and it gets really red. You have to have a little information. Or allergic conjunctivitis is a possibility, but the most common case is either viral or probably most commonly bacterial infection. Now, if this is an infection and affecting an athlete, it's typically a huge concern because this condition is very, very contagious. So let's say a basketball player developed this condition. He scratches his eye and touches a towel, and another team player, his teammate touched the towel and then maybe wiped the face. This condition can spread quickly throughout the team. Another big condition, if your patient is a swimmer and he or she cannot get in the pool until, say, he starts to take the antibiotics and then become uncontagious after several days. Signs and symptoms, redness, and sometimes this gooey stuff, it just basically covering this entire upper and lower eyelid, and an eyelid might actually feel stuck, especially in the morning when they're waking up, burning and itchy sensation. If it's a viral infection, they may not have that much of a color, so it might be just a watery discharge. If you see this nice yellow color like in this picture of green, it might indicate a bacterial infection. What you're gonna have to do if you identify this condition is refer immediately. This patient needs to start to take some antibiotics, so the sooner you refer, the better. Foreign bodies, maybe you have got this before yourself, and I know sometimes it's a very, very small object, but it does feel like a brick sometimes. Now, worst thing that your patient can do, and typical thing that they try to do, is they try to typically scratch that eye. But why is it bad? Well, they can actually push that object further into cornea, and by trying to scratch it, they can actually create the corneal aberration. So again, try to scratch it is the worst thing they can do. You should be telling not to do so. If they're wearing a contact lens, they should try to remove that immediately. And next thing that you should try is, it's kind of a natural reaction for a patient to start to experience some tears coming out. Okay, it's just a protective mechanism, and that's a good thing. They start to lubricate the eye, and they should try to blink a couple times to see if the objects start to move a little bit. Now, if it feels like it's still not moving, or it might be just floating around and not really being able to push this to the corner of the eye, next thing that you should try to do is try to flash that object using either water, saline solution, or eye drop. Now, when you're using, say, for example, water, make sure that you are tilting patient's head like this, so the water is going to hit the corner of the eye and it's going to push that object towards the other corner of the eye. Okay, so you try that a couple times to see if that is enough to push that foreign object out of the way. If this irrigation is still not successful, you can actually manually try to pull the upper eyelid and gently pull it away from the eyeball and not pull it down, so you can use the eyelashes of the upper and lower eyelid. You can use them as a brush to try to move the foreign object out of the way. This one is known as brushing maneuver. If this still doesn't work, then the examiner can try to evert the upper eyelid, as maybe you can see in this picture, or maybe you can see in this picture right here, to see if you can kind of catch the foreign object right there in a posterior aspect of the upper eyelid, and maybe you can just get it removed from there. In order for you to sweep this object, you are allowed to use a wetted or moistened cotton applicator, or maybe corner of the gauze pad. Try to get the foreign object removed, but make sure that you're just kind of sweeping the surface, you're not pushing anything, and you're never supposed to touch the cornea. Again, that can lead to corneal aberration and making the condition worse. If the object is completely stuck, and then maybe it's very possible that this object is embedded within the cornea, and you try everything and nothing is moving, definitely consider referral so the eye doctor, the specialist, can get it removed. And it's very normal for a patient to experience some soreness even after the foreign body is removed. They might need to use a little bit of an eye drop to facilitate the healing of the surface of the eye. Corneal aberration, or scleral aberration or maculations. This one is also called sometimes as an open globe. Now, corneal aberration might be very small that you may not be able to see it. If that's the case, then you're going to use very specific stain to really visualize the damage over the cornea. If you're looking at more severe cases like actual scleral lacerations, you might be able to see the damage, which is typically not a great sign. If it's a bad case, it may require surgical repair. Typically, even if it's a very small corneal aberration, people would experience a significant pain. They may not be able to open their eye. Their vision might be affected, and they might also develop photophobia. High fever is also a possibility. Again, if you see that, you should consider immediate referral. If it's a very small, say, amount of scratch here right over the cornea, just a corneal aberration, the patient would need to just get the eye drop, and then the cornea has excellent ability to heal, so within a few days they should be feeling completely normal. But again, if the tear is extending a little bit more towards the deeper layer, they should go to ER, and then maybe surgery might be needed. The next condition is known as orbital fracture, sometimes known as blowout or blow up. So if the object literally hit the eyeball and then pushing the eyeball inside, the most fragile part of the bony orbit, which is the floor typically, is going to get broken, and you actually experience a fracture here. Depending on which part of the bone is being affected, you can sometimes call that as blowout fracture. You're talking about the medial wall or orbital floor, or blow up fracture. Again, depending on what part of the bony orbit is being affected. They will have pain and definitely difficulty moving the eye. Diplopia is a very common sign of symptoms. And sometimes they would actually feel referred pain around the mouth area as well. Ecchymosis swelling is a very good possibility. This is a facial fracture. And here, eye might appear a little bit sunken in and start to get a little maybe pushed in and medially, or maybe inferiorly displaced. If you're going to ask them to move their eye, say for example from this condition, this person is experiencing a fracture here, if you can ask this person to look up, they can perform that with no issue with this eye. However, this eyeball is not going to move because the eyeball is going to get pushed and then now kind of a sitting in this area. You cannot move that eyeball. If you ever suspect this condition, this would need an immediate referral because they need to go back and surgically fix this orbital floor or medial wall. You should definitely also consider about the muscular damage as well as the cranial nerve damage, and they're going to have to perform the CT scan like in this picture to confirm that diagnosis. Tear in the retina and detachment. This could be caused by illness. Again, specifically maybe diabetes might be a good example. Injury, the repetitive impact to the head can actually lead to damage to the retina. There's some genetic component to it too, and definitely aging component. This condition is much more common among people who have myopia, nearsightedness, or maybe the person who had eye surgery before, or eye trauma before, or a person who has family history of retinal detachment. Interesting thing about this condition is it's typically a painless condition. So how do they typically realize that something is wrong with their retina? Well, they might experience something known as photopsia, which is known as the really brief flashes of light, and also maybe sudden increase in floaters in their vision, as well as maybe something like this. People would often describe it as a carton fell in my vision and just not going anywhere, start to block my vision. That kind of a description is very common. If they ever start to describe those kind of symptoms, you should consider immediate referral to eye care professional. Typically, the retinal specialist will need to take a look at this eye, try to perform really detailed inner eye structure examination. Surgery is often required because if you don't do anything soon, this retinal detachment can actually get worse. So let's say this person is experiencing this visual limitation over here. This can actually start to spread and then potentially affect the entire visual field. So this is a picture of abnormal ophthalmoscope view, and then you can see the retina start to get a little bit detached here. There's an actual specific tear in the retina, and retina start to detach here. Another picture here, you're experiencing the tear, and because the fluid can move towards the back of the retina, and that can actually start to peel the retina even more. Again, if you don't do anything soon, you can actually worsen this condition. for if that patient or athlete has upcoming flight trip schedule, they need to cancel that because change in the pressure can make this condition worse. Also, for boxers, this might be often a career-ending injury because those boxers would often experience the impact to the head. And every time they get a little bit of an impact to the head, it can actually facilitate further detachment of the retina. So for boxers, this injury unfortunately is often known as a career-ending injury. Not always, but often career-ending injury. So what does NCAA say about the eye injury and maybe the protective eyewear? NCAA recommends that the protective eyewear for all sports should be recommended actually for all sports that involved a projectile. So something that has a size that can potentially damage the eye. So maybe baseball might be a good example, lacrosse. So those sports, they're encouraging athletes to wear protective eyewear. Another thing that they said that the protective eyewear should be mandatory for athletes who are functionally monocular, meaning that only one of their eyes is functioning right now, the other eye maybe practically blind. If that's the case, then they must wear protective eyewear. That's what NCAA is pushing. Additional thing that NCAA recommends athletes, again with the functional monocular, they should consider playing sports something other than contact sports. So again, boxing, wrestling, football, martial arts, they don't typically recommend that. And also participating in high velocity projectiles, maybe baseball, hockey. NCAA is discouraging athletes to participate sport like that if they are functionally monocular. Some special consideration to think about. Sun exposure, the very prolonged sun exposure can actually lead to eye damage, such as cataract or macular degeneration. So it's probably a good idea for athletes to wear sunglasses to protect their eyes. Now, selection of sunglasses is also another very important factor as well. Some people might just think about the looks, but it's very important that athletes actually wearing the 99% UV absorbent sunglasses instead of maybe something cheap or something that's looking super cool and awesome. If you as a healthcare professional are going to be spending a lot of time outside, you should be doing the same for yourself. So if you're an athletic trainer, maybe working primarily with something outdoors, something like football or soccer, then you should consider wearing sunglasses yourself as well so you can protect your eyes. Okay, so that's going to be it for this lecture. I'm going to see you on Monday in biomechanics computer lab for the test. But if you are studying this weekend and have any questions about the content or say anything about the test, feel free to email me. I'll try to get back to you as soon as possible. If anything, you can definitely ask me that Monday morning before the test. So I'll see you on Monday. Have a great weekend.